Dear friends, I am Dr. C.J. Keshwamurthy. Welcome to my Geriatric Medicine Channel. Previous episode, I have talked to you about several things about the cardiovascular system, including many things, the heart attack, BP, etc. Today, I am going to talk about the stroke. What is stroke? Can stroke be treated? Stroke in English, in medical term, is called hemiplegia. Stroke ranks first in the frequency as well as in urgency among neurological disorders. A stroke happens when blood supply to the part of the brain is cut off. This may be due to a clot developed in several parts of the body, including varicose vein, which blocks one of the blood vessels. It is called ischemic stroke. When the blood supply is cut off, it is called ischemic stroke. Or a bleed, hemorrhage into the brain. That is called hemorrhagic stroke. All the body functions controlled by the affected part of the brain becomes disordered. The prognosis is better in ischemic stroke, as there are several agents called RTPA, etc., available in the market, can be given by infusion for over 1 hour the patient, where the blood flow will be restored within a short time if the patient attends the suitable hospital within 3 hours. It is called the window period. Okay. How to recognize a stroke in the early stage? Early symptoms of the strokes are as follows. It should be recognized early. Sudden weakness or numbness of one side of the body, sudden dimness or low vision, particularly in one eye, sudden slurring of speech or loss of the speech altogether may be another symptom. Unexplained dizziness, difficulty in walking, or there may be falls also, FALL, fall also. Sudden severe headache with no apparent cause, difficulty in swallowing, sudden confusion, nausea, and vomiting also may be there. What are the common problems resulting from the stroke? What happens when a stroke occurs in the body? Problems resulting from stroke are multiple, sir. They are paralysis of one side of the body, including face, balance problems while walking, frequent falling will be there. Speech is often affected mainly when the right side of the body is affected, because the speech center is situated in the right side of the brain. That should be properly understood. Pressure sores may develop, depression may develop. Oh, what happens in the future? We don't know. Oh, how to lead life. All these things leads to depression of the patient. Okay, what happens? How to prevent stroke now? Stroke is preventable ailment in the following if the following strategies are followed strictly. Control your hypertension. I have been often frequently telling you about the dangers of high blood pressure. That high blood pressure should be controlled and brought down to normal levels within a, 1 or say about 2 or 3 months. Treatment of heart problems, for example, heart attack, heart failure, irregular heartbeat are often the cause of hemiplegia or stroke. Measurement of serum lipids. like cholesterol, triglycerides, HDL, LDL, etc. And the proper treatment should be taken if the cholesterol level is very high. Recommendation to stop smoking, to use alcohol only and to use alcohol in only moderation, and to exercise regularly. This smoking is a horrible thing. The carbon dioxide level goes down, and various changes take place in the heart and the brain, uh, and so it should be curtailed to a very minimum. Better stop it. Alcohol should be in moderation. If it exceeds the level, it causes several damages. Exercise regularly. Regular exercise is must. At least the elderly should walk for 1 kilometer or at least half an hour in every day. Every day it must be. I stress upon this point. The exercise is the most suitable preventive measures of stroke. The blood supply increases to the brain tissue properly if the exercise is done properly every day. Warning against overeating. The obesity is another factor. Obesity should be avoided. The overeating and eating the stuff with oils, ghee, etc. should be curtailed. Undereating is also a problem. Undereating to reduce the body weight is also a problem. So moderate eating, and it should be taken, and daily say about 1,500 kilocalories of food should be considered. Many people think that if they walk for 5 to 6 kilometers per day is healthy and is healthier for the body and avoids all the diseases. No, it is not like that. Not like that. There are several factors, dangerous factors, included in the overworking. So the fatigue should be avoided. One should not get fatigued while walking. As soon as the dangerous sign, they say the pain in the jaws, the neck, etc. occur, they should take rest and restrict walking and exercise. Fatigue should be properly treated. Then the treatment of blood disorders, anemia, bleeding disorders should be properly treated to avoid stroke. Dear friends, today I have given you a hint about the details of the strokes and how to stop it, how to prevent it. Go through the channel, like it, subscribe it, and share it. Thank you very much. Jai Karnataka, Jai Bharat.